As a healthcare professional, there are several strategies and techniques you need to know to effectively work with residents experiencing vision loss. Our goal in this video is to help you learn to recognize the signs of vision impairment, to understand common eye conditions, to discover some common tips to build your confidence working with elderly vision-impaired residents, all the while keeping residents safe and secure. And finally, to learn simple ways to work with residents who are losing vision, including ways that will dramatically improve their quality of life. So how can you recognize the signs of early vision loss? First of all, most vision problems related to age develop very slowly over time, and the warning signs may be misunderstood. And making it even more difficult to recognize is the fact that your residents may have learned early on how to creatively mask what's really happening.
Nursing home staff can see people having difficulty reading the menu or the activity calendar and asking, what does that say? Or not coming to meals on time because they can't see their watch. Or asking who you are.
If they aren't able to read their mail, and many times they won't complain they can't read the mail, but they'll let it pile up. If they have difficulty eating, difficulty getting around the nursing home, falling, if they don't want to watch TV any longer, they say the TV is too blurred, or I've got to get closer to it.
If they're experiencing more falls in their apartment, they tend to be more cluttered in their apartment, and usually some troubles with, they'll ask us to help read their mail, and they usually try to do it in a pretty discreet way because it's a pride issue. So they'll ask us to help read things, and then usually along with that, then I'll see them request for medication assistance as well, because they know that's very important. So they don't want to make any mistakes with that.
But you can be aware of any changes in your residents' reading habits. Have you noticed avid readers who are now rarely or never seen with a book? Also, observe how a resident holds books, newspapers, and magazines. If he or she holds the material extremely close or a long ways away, that's a sign of poor vision. Another sign of vision loss deals with changes in orientation among your residents. If your senior residents are having trouble recognizing familiar faces, or you see any changes in their eating habits or table manners, such as difficulty putting sugar in their coffee or consistent spilling, they may have vision problems. If you do notice changes in your residents' vision, it's important to express your concerns to other family members and other staff. Ask thoughtful questions and discuss any changes the family may have noticed regarding the resident's behavior. It's also important that your residents receive regular eye checks. Regular eye care can reveal the presence of glaucoma, cataracts, diabetic retinopathy, and the onset of macular degeneration, the most common cause of vision loss among seniors. The signs and symptoms of eye disease vary from person to person. It's best to talk with a vision specialist in the medical community and to discuss any concerns with the resident's family. Partial sight is when your vision no longer meets your needs, and even prescription eyeglasses don't help. Vision loss can range from tunnel vision to blind spots to legal blindness to almost total blindness. Legal blindness is visual acuity of less than 2200 in the best eye with the best correction or tunnel vision. That correction can be provided by glasses or contact lenses. This means that what a healthy eye can see from 200 feet, the legally blind individual must be 20 feet away to see the same object. Macular degeneration is the most common cause of vision loss for people over 50, accounting for almost 45% of all cases. The macula is the tiny area on the retina that sees fine detail. As people age, the macula can become damaged, causing a gray or blank spot to appear in the center of the visual field, resulting in loss of central vision. Glaucoma is a group of diseases that damage the optic nerve due to increased fluid pressure in the eye. It's the second leading cause of vision loss, and is the #1 cause among African Americans. Left untreated, glaucoma can cause tunnel vision or total blindness. A cataract occurs when the lens of the eye becomes cloudy. Colors and detail become more difficult to see, and surgery to replace the lens may become necessary. About half of all Americans between the ages of 65 to 75 have cataracts. Another eye disease, diabetic retinopathy, may result from having diabetes. Diabetic retinopathy occurs when the blood vessels in the retina either leak fluid or grow abnormally. Regular eye exams are very important for the residents in your facility for 2 reasons. First, eye exams ensure residents are using the proper lenses. Second, regular eye exams serve as a check for eye diseases and conditions. In fact, frequent eye exams are important for a person who has diabetes, for example, because the longer a person has that disease, the greater the likelihood of developing diabetic retinopathy. It's a sound idea to have your residents checked for eye diseases, for both your residents' well-being and your need to know to provide the best possible care. Here are important courtesy tips everyone should know when interacting with and caring for residents who are blind. First off, don't think of your resident as a blind person. Your resident is first and foremost a person who just happens to be blind.
For treating persons who have vision loss, you treat them as you would anybody else. You treat them with dignity, with respect. You offer them the option of doing things by themselves, where they can do so safely and easily. But you also make sure that when that person with a vision loss is with another person and you're there to meet with that person, you don't talk to the person accompanying them. You talk directly to the person themselves.
When talking with residents, remember to speak, don't shout, directly to the visually impaired resident, not through a companion or family member. Visually impaired residents can speak for themselves. Identify yourself when entering the resident's room and introduce your resident to others. Also, let the resident know when you're leaving. Don't rearrange your resident's possessions. They're very familiar with their setting, and rearranging items will cause confusion and frustration. Never leave your resident standing alone in an open space. Offer a chair or directions to a stationary point of reference, such as a counter or table, and remember to give explicit directions. You don't have to shy away from using words like see or look. Residents understand these words are conversational and are not meant to offend. Never push, pull, or grab a blind resident. Offer your arm and walk at a normal pace. Approach stairs or steps squarely. If it seems like a resident needs help, please ask. When it comes to meal times, describe the positions of the food on the plate by relating them to the numbers on a clock. For example, the potato salad is at 2 o'clock, the sandwich is at 6 o'clock, and the cucumbers are at 10 o'clock. This will ensure the residents enjoy their meals. Keep in mind your residents' ability and desire to maintain their independence. Let your residents do as much as possible for themselves as they can safely manage.
What we want to do is we want to work with people so they can maintain their independence, be active in their community, and do the things that they used to do before they had problems with their vision, before they've gone blind.
Incorporating these proper strategies and techniques can help ensure that your residents' quality of life is maintained. There are many simple ways you can work with your residents. Let's start with lighting. Blind and visually impaired residents are affected by the quality and nature of light. Choosing the right lighting options for your facility will go a long way toward maintaining their well-being. Your nursing care community can look at ways to increase lighting by increasing the wattage of light bulbs or experimenting with different types of light bulbs. If there are individual lamps in residents' rooms, a bullet-shaped shade lets you or your residents easily direct where the light shines. Gooseneck floor or desk lamps with their adjustable necks make directing light easy. Also suggest your residents carry a small flashlight with them when they go out with family or companions. This makes reading menus and programs easier. Try and minimize glare as much as possible. Have your residents face away from windows when they are reading or working. This way, the light will shine at their back and over their shoulders rather than directly into their eyes. Shut the drapes or adjust window treatments in their rooms. Have them wear wraparound sunglasses to block the glare of the sunlight without decreasing the overall brightness. Sunshades can be worn alone or over glasses and are available for indoor and outdoor use.
For people who are low vision, they will be greatly affected by being in the sun, for example, or even having LED lighting where overhead office lighting that just brings too much light or a lot of shadows in the room. So there's a lot of things with that. And so if I meet with somebody, one of the first things I ask them is, how is your vision doing today? Do you have good days and bad days?
Besides lighting, there are several other ways to make residents' surroundings comfortable. First off, for visually impaired residents, keep common area environments predictable, neat, and safe. This applies to your residents' private rooms as well. Furniture and adaptive equipment should be placed in obvious locations. Position the television closer to the resident and keep frequently used items, like large button remotes, stored and returned to the same place. Gather together your residents' most frequently used items so they're handy. Hallways and stairs must be clutter-free. Remember to maintain a safe passage between residents' rooms. Keep wires, cords, sharp corners, and hanging objects away from highly trafficked areas. In living areas, use fabric paint and raised bump dots for marking radio or TV station settings and other controls that may be hard to see. Use contrasting colors to make items more visible, such as using dark-colored placemats under light-colored dinner plates. Employ a large button telephone to make dialing easier. Keep white paper and a bold marker by the phone for taking notes. Throughout your care center, you need to work to reduce the risk of falls. Remove area rugs or fasten them down. Use non-skid, non-glare floor products instead of wax. Hide or tape down electrical cords. And mark the edges of stairs or steps with bright contrast tape. Open or close doors completely to avoid collisions. In the bathroom, check lighting and glare control frequently. Eliminate glass containers by transferring products to reusable plastic ones or by installing plastic cup or paper cup dispensers. Grab bars, safety handles, and non-slip mats in contrasting colors are essential in wet areas. If possible, use contrasting bathroom fixtures instead of everything in the bathroom being all white.
Safety impacts those people who have vision loss just as it impacts those who can see fine. But for a person who has vision loss, for instance, in the bathrooms where there's a tub and there's a grab bar, sometimes in the newer facilities they try to make the tub surround look aesthetically pleasing. So they put a white tub surround and they put a grab bar in, but the grab bar is white. And a person who has vision loss can't separate the white from the white and can't see where the grab bar is. So we talk a lot about, with staff about using high contrast.
And when it comes to brushing residents' teeth, teach them to squeeze toothpaste while holding the head of their toothbrush between their fingers. Or they can always squeeze it directly into their mouths. The most critical thing to remember when working with your visually impaired residents is to watch, listen, and use common sense. You can do this. It's very easy to include these few procedures into your daily routine, which will certainly help make someone's day easier and more enjoyable. Before long, they'll become a regular part of your routine, and you'll be able to apply them to all your residents.